Good afternoon, all. I wish you all well today. We're here at April 23rd's weekly COVID-19 update meeting. As most of you know, we do have a little bad news. We are in it. We will get through this together. We will work hard and we will do all our precautions to try and stay safe and to get through this as minimal as possible. I want to thank everybody who has a working hand all these weeks that we've been going through this pandemic. Thank you all very much. God will bless you. To our people, don't worry, we will be okay. But we have this, acknowledgments of our Winnebago Public Schools athletic wrestling program. A little statement I want to read. This pandemic has hindered some of our acknowledgments that we want to recognize. The Winnebago Public School wrestling program has done a great job on giving opportunities to school athletes. On behalf of the Winnebago Tribe of Nebraska, we would like to congratulate the Winnebago Public School Wrestling Program on another NSAA state qualifier, Robbie Lovejoy. The council wants to present Robbie with a commemorative jacket and also give the coaches a jacket as well. We are not to physically present him, but we want to send him our wishes. Robbie Lovejoy was 220 pounds, 2020 state qualifier. At the state championship, during his first match, Robbie upset his opponent, who was ranked in the state. It only took him 55 seconds. He lost his second match in the quarterfinals. That opponent ended up winning second place in the tournament. Robbie then won his third match against another tougher opponent by a wicked lateral drop. In his fourth match, Robbie could not execute his signature move, and that ended his state run. However, we could not have been more proud. We are very proud. We want to say thank you for bringing a lot of pride to Winnebago. We are proud of everyone that had a hand in the state run, his teammates, all the parents supporting him and his coaches. Please join me in a virtual round of applause for Robbie Lovejoy. Congratulations, Robbie. I would also like to mention and thank Coach Tramner, Coach James, and Coach Putnam. Thank you all very much. We're going to have a lot of questions today, so I want to turn this over to our health department, Mona Zavante. Thank you.
That's going out today, and it indicates that we now have our first known case of COVID-19. It reads the following. The Winnebago Comprehensive Healthcare System, which is comprised of the Winnebago Public Health Department and 12 Clans Unity Hospital, has confirmed the first case of 2019 novel coronavirus disease, COVID-2019, in the local area of Winnebago. Testing was conducted with a sample taken at the individual's home by the Winnebago Public Health Department's Public Health Nursing Department and shipped via carrier to a certified laboratory to confirm diagnosis. This individual is in good condition and remains isolated at home to prevent spread of infection to others. To protect the patient's privacy, no other details will be released at this time. The individual who tested positive is suspected to have been a community spread case. The Winnebago Public Health Department is actively investigating when the individual's symptoms began and is reaching out to any potential contacts of that individual. The Winnebago Public Health Department and the 12 Clans Unity Hospital are working in cooperation to take all the appropriate steps to identify potential exposures, ensure necessary isolation precautions are taken, and provide testing to individuals when warranted. We continue to urge community members to stay home as much as possible and to practice social distancing if you must go out for essential supplies, says Danelle Smith, our Winnebago Comprehensive Healthcare System CEO. COVID-19 is a respiratory illness with no known cure or vaccine. Community members experiencing shortness of breath, sore throat, runny nose, and cough are urged to call the COVID hotline at 402-922-1508. Per the Center for Disease Control and Prevention guidelines, it is recommended that individuals stay home except to get necessary medical care. Individuals with underlying conditions such as diabetes or those with compromised immune systems are the most high risk for contracting this disease or this virus. Prevention measures include washing your hands, often with soap and water, for at least 20 seconds each time, and routinely cleaning frequently touched surfaces. Other recommendations, including social distancing and remaining at least 6 feet away from each other with groups of no more than 10 people. The Winnebago Comprehensive Healthcare System has been taking many steps to further protect the health and safety of the community. These steps, among others, have included implementing a no visitor policy within the hospital, increasing the frequency of cleaning facilities, making certain services available remotely, implementing a drive-through pharmacy, and placing staff on telework status when possible. So I understand that there's an increased panic now that we are all facing with the first positive case here in Winnebago. We have seen an increase of testing this past week, as the testing criteria is constantly changing to be more lax and allowing us to test more individuals with less symptoms. What does this mean? That perhaps on Friday you were unable to be tested, but now on Wednesday with some symptoms, you are now able to be tested. We continue to partner with the 12 Clans Unity Hospital to coordinate testing procedures. It is imperative now, more than ever, that we continue to social distance and isolate. So what does the Winnebago Public Health Department do when we think either someone might be COVID-19 positive or is being tested? So we interview the person that we're thinking about testing, and we interview them for all their close contacts for the past 7 days. The person A says during their interview that they went to visit their mom. Then they went to their nanny's house. Then they went to their sister's house. We then have to increase isolation for their mom, their nanny, and their sister until the outcome of the test. If person A tests come back negative, then we remove the quarantine and the further isolation to all the close contacts. If person A test comes back positive, then we further interview all of those we have placed on heightened isolation. We monitor them for symptoms, look at their inner circle to place them on an increased isolation status. If they start to have symptoms, we will advise them to have a test performed. Then the cycle of investigation continues again with each of those people and all of those people that have been in contact with each of those individuals. This is why it is so important to not visit others that don't live in your household, because now person A has now exposed their inner circle, and then their inner circle has now exposed their further inner circle. So we are all at risk. This is why we have been asking everyone to isolate and social distance, because the chance to infect others is only decreased if we follow the guidelines. I also want to thank, on a more positive note, the medical services program that last week delivered 54 food boxes to the elders. I would also like to thank the Atlas program and the Winnebago tribe and anyone else that had a helping hand in coordinating those efforts. We want to encourage everyone to stay home. Stay home whenever possible. Avoid gathering in any groups. Do not visit or host people who do not live with you. Stay healthy. Keep at least 6 feet distance from anyone who doesn't live with you. Wash your hands often for at least 20 seconds. Stay home if you're sick or if someone in your home is sick. Stay connected. Stay in touch with friends and loved ones through social media or phone calls. Check in with your loved ones. All of us are at risk for COVID-19 infections. Please stay home, stay healthy, and stay connected. So with that being said, I want to turn it over to Ms. Angela Keller, our Public Health Nursing Director, that will start this week's presentation. Thank you, everyone.
Hey, Angela, 1 second here. We got technical difficulties. Make sure you turn your mic on. Appreciate it.
Can you hear me now?
Yep, we can hear you. Thank you.
All right, sorry. I just want to thank everyone for being a part of this and watching this and keeping your community safe and healthy. And I know it's a trying time right now, but I just want to reiterate what Mona said, and that as long as we're doing everything that we can personally to keep ourselves safe and healthy, then we will keep the community safe and healthy as well. So with that, we'll go ahead and get started with the presentation. Sorry. So the current statistics for national and local is in the US, there is 776,093 total cases of COVID-19. The deaths in the US is 41,758. The total Native American cases in the US is 1,152. In Nebraska, there is 1,152 cases. There's 38 deaths. There is 14,957 negative tests completed, and a total test of 16,813. Here in Winnebago, we do have one positive. There has been 5 Winnebago cases that have tested negative. There is one that is still pending. So the total number of Winnebago cases that have been tested is 7. Here we do test eligible individuals that are eligible for care here as well, and they might live outside the Winnebago area, so we wanted to include those statistics as well. Non-Winnebago cases testing positive is 1. Non-Winnebago cases that have tested negative is 10, and there's 1 pending. And then non-Winnebago cases that have been tested total is 12. And then I know that there's a lot of questions going on with risk exposures, especially now that there is a known case here in the community. So I want to kind of go over the different risk groups that are classified with each investigation relating to any COVID testing. And that way everyone can be a little bit more educated and kind of know where they stand. So the highest risk exposure group are those that are recognized risk of transmission. So those are that are very high probability that they could have transmitted the disease. Most of those cases are household members, close family members, and contacts within the household, and that's of a confirmed or a probable positive case. The moderate risk exposure groups of unknown transmission are mainly healthcare workers with unprotected close contact with a confirmed probable case. And then there's the low risk, which is much of the community does sit in. There's a low risk exposure group, and that's where the transmission is unlikely. So that's when others have had a social contact or a short duration with a firm probable case in a non-hospital setting. So that would be walking by somebody on the sidewalk, or pumping gas, or going into a convenience store and having somebody walk by you. Those are the very low risk exposure groups. For a close contact exposure, it is identified as having greater than 10 minutes of contact within 6 feet of that individual. So those are the guidelines we're using to do investigations. And then we're following this risk exposure groups as well. The most important, or one thing that everybody can do to help prevent any exposure within the community, is to wear a mask. And that's going to prevent anybody that is asymptomatic, that is carrying the COVID-19 infection, from spreading that to other community members or from other people in their household. So I know we went over this last week, but I just wanted to touch base on it again. Whenever you put a mask on, you always want to wash your hands. You wash them with soap and water for 20 seconds, or use 60% alcohol sanitizer. And then make sure it's rub till it's completely dry, and then you can go ahead and place your mask on your face. You want to be sure that you are minimizing the number of gaps of available or around the mask that are on your face, to help decrease the amount of anything that could get around the mask. If it does become soiled or damp, you do want to replace your mask and get a new one. And then if it is soiled or damp, you do need to dispose of it correctly. So you just remove the mask, and you want to use it by taking the ear loops or untying it from the back of your head and disposing of that in a trash can. You do not want to touch the outer side of the mask or the inner side of the mask. And then wash your hands immediately after removing it. For those that are using cloth masks, you want to follow the same precautions and the same criteria for placing and taking it off. The one thing that you do instead of throwing it away is you can wash it in the washing machine. So you just want to wash it on the highest temperature possible that the material can handle. You want to use the correct amount of laundry detergent. You don't need to use an excess amount of laundry detergent, just the normal amount is fine. And then you want to hang it to dry. I know there are some places that are saying to dry it on high heat, but hanging it to dry is fine. You just don't want it to touch any surfaces, because then bacteria can like to absorb in that damp surface on the mask if it's sitting on a countertop. So that's why you want to hang it to dry, so it doesn't touch anything, and the risk of any bacteria or virus or infection or any germs getting absorbed into the mask. And then, as always, whenever you are wearing a mask, you do want to avoid from touching your face as much as possible. I know it's a new process and it seems like everyone's doing really well with it and putting it on and making sure they're wearing it when they're out in public, but just still refrain from touching your face and trying to reposition it. And then with the hotline available for individuals to call in or community members to call in to get information, I kind of wanted to go walk you through what would happen if you called into the hotline. And Mona had said that number before, but I'll give it again. It's 402-922-1508. And when you call in, you will get one of the public health nurses who will answer the phone and kind of go over this, get some information from you. So the first thing they're going to do is they're going to get your name. We need to know who we're talking to so we can help personalize it as much as possible and get the correct information. We will ask your location of residence. So if you live within the Winnebago community, outside the Winnebago community, and where you're living. Of course, your reason for calling, if it's just information, if you're reporting symptoms, if you have questions, anything like that. And then we will ask if there's any COVID symptoms present. So the main symptoms we will ask for is if you have a fever, cough, shortness of breath, difficulty breathing. There are other ones that are out there that have been identified to be connected to the COVID. Sorry, that is fatigue, quick onset of fatigue, so severe tiredness. Diarrhea can be one of them. So if you have loose stools for a matter of days, a headache has been reported with it as well. So all of those we do want to know about if you experience any of those. After the information is received, the nurse that you're speaking with will go through it and will kind of triage the situation and will advise what is the best for you to do based on the information that you did give us. With that, there's usually two things that can happen if it's somebody that is reporting symptoms or has identified themselves as an exposure to a positive COVID case. First, we would give you, if the criteria is not met for testing, we would advise you to stay home and then follow strict isolation precautions. And then you need to self-monitor for symptoms. So the strict isolation precautions are to stay in your house. We don't want you going out in the public, meeting with other friends, other family members. We need you to stay in your home. And then to monitor for symptoms, we want you to check your temperature. We want you to check to see if you're having any difficulty breathing, chest pain, chest tightness, anything along those lines. And if you are, then we would ask that you would call us back to let us know about anything that is going on. If it is found that a COVID test is necessary or is warranted, and that the person calling in does meet the criteria, an appointment will be arranged for COVID testing to be completed. We will notify you of the details about that appointment, whether it will be, you will need to come into the clinic, if you can just come to the facility and we can do the testing, or what would need to be done with that. If a test is conducted, the public health nurse will follow up with you daily to help monitor symptoms to make sure they aren't worsening or if additional medical care is needed. If the test is negative at that point, you want to continue following social distancing measures and the precautions that we've outlined. Just because it's negative now does not mean that if you do not follow those social distancing measures, that you could increase your risk of exposure in the future. So you still need to make sure you're following those measures. You need to self-monitor for any symptoms. And then you need to contact the hotline again if any further symptoms develop or if there has been any new known exposures that you are aware of. If you do test positive, the health department will check on you twice a day and will help monitor your symptoms and try to create a little increased awareness to see if they're worsening or getting better. And then we will assist you to get any further medical care that's needed. So if there is medical treatment that is needed, then we will hopefully get that arranged for you as quickly as what we can and get you the treatment that's needed. The symptoms of the COVID virus include, like I said, fever, cough, shortness of breath, difficulty breathing, and then those other ones that I had mentioned that have been connected to it, but are not do not happen very often, but they have seen a connection to the COVID infection. They usually will appear between 2 to 14 days after exposure, and that's after that close contact, that high risk exposure usually is when it happens. And again, the exposure that we're talking about that we follow up with when a case is being investigated is those close contact. So that's that less than 6 feet contact for greater than 10 minutes. So walking into a building or working in a facility that might have a known case does not imply that you have been identified as a close contact. If you do meet the criteria, if you've been in close contact or you do have any symptoms at all, we do want you to either reach out to your your provider or to the Winnebago Health hotline, and then we can help facilitate whatever needs you do require. And that can include testing or help with self-monitoring or give you the guidelines for self-isolation or social distancing. And then we put in a chart here to help identify because everybody has a different exposure level. So we want to help identify to help clear up any confusion that's happening right now. So if you or someone in your home has an exposure, what you need to do is you need to self-monitor. You need to be alert of any symptoms that you have. You need to watch for your fever, cough, or shortness of breath or difficulty breathing. That does include trying to monitor your temperature. If you do not have a thermometer, then we will try to get you, we do have some disposable thermometer strips we can get out to you to help monitor your temperature a little bit closely. You need to make sure you're practicing social distancing, maintaining a 6 feet distance from others and stay away from crowded places. As Mona had said, we want you to stay with your family. We want you to stay with your household family members. We don't want you going out and going into other households or seeing other family members. We would like for you to try to stay with your household family members and then using virtual means necessary to communicate with the individuals that you're not able to be around. You want to contact your healthcare provider or the Winnebago hotline if you develop any of the symptoms. And then the next scenario is if you feel healthy, but you have been identified as a close contact with somebody that's been COVID-19 positive, or if you traveled outside the Iowa, Nebraska, and South Dakota. At that point, you do need to self-quarantine. What self-quarantine means is you stay in your home. You do not go outside of your home for any reason except to get medical care, and you need to call before you leave. You need to check your temperature twice a day, once in the morning and once in the evening. And again, if you do not have a thermometer available, we do have those disposable strips that we can get out to you to help get you the things that are needed in order to monitor your temperature. Generally, you would stay home for a 14-day period and you would self-monitor for your symptoms and then report those symptoms to the healthcare worker that would call in to check on you daily. If those symptoms arise after you've gotten your daily check-in call, we do want you to reach back out to that nurse that had contacted you to let them know that something has changed and that you have developed symptoms. And then if possible, you do need to stay away from anybody that is high risk of getting sick. So that's anybody that has an underlying medical condition, anybody of 60 to 65 years or older, just any of those high risk criteria. So the underlying medical conditions are lung disease, heart disease, diabetes. And then if you have been diagnosed with COVID-19 or are waiting for results, or you have symptoms of a cough, fever, or shortness of breath, you need to self-isolate. You need to stay home and stay in a specific room. You can call it your sick room, or in an area away from other people or animals, including pets. If it is at all possible, we do ask that you use a separate bathroom and it is wiped down. If it's not possible to use a separate bathroom, then you need to wipe it down between each use that the probable case or the individual that is diagnosed with COVID or is awaiting test results, they need to wipe it down between each use. And then for self-care tips at home, because anybody that does get the COVID infection or is diagnosed with it, 80% of them are able to self-care at home and have mild symptoms. So you need to stay home from work. You need to stay home from school. You need to stay away from any public area. If you must go out, the only place you should ever go is to get medical treatment. And then you should call your provider before leaving so they can get everything ready for you and your visit. You need to make sure you monitor your symptoms carefully. Like I said, check your temperature, check to see if there's any increased shortness of breath or difficulty breathing, or if there's new onset symptoms, to please notify your provider immediately. You need to stay home and you need to stay in bed or stay home and get rest and stay hydrated. So you want to make sure you're drinking plenty of water. Hydration and rest is going to be one of the best ways that it's going to help your body give it what it needs to get over this virus. I said it a couple times, but if you do need to seek medical treatment and your symptoms are worsening, you need to call your healthcare providers ahead of time. And that's even if you have to go to the ER, so that they're aware, so they can get their PPE on and get everything that's needed for you and your visit. If emergency services are needed, you need to let the dispatch personnel know that you do have a known case of COVID-19, or that you're awaiting testing results, or that you're a probable positive, that you've been a close contact exposure and that you are experiencing symptoms. You need to make sure that you're covering all of your cough and sneezes with a tissue, and then disposing of that tissue right away after you've used it that one time, and then washing your hands immediately afterwards. You don't want to touch your face or any part of your eyes, nose, or mouth without washing your hands. You need to wash them often, and then the guidelines are 20 seconds with soap and water, or with alcohol-based sanitizer that contains 60% alcohol, and you need to rub your hands together until the alcohol has dried. As I mentioned in the last slide, you want to stay in a specific room. You want to stay away from people within your home. You don't want to share communal areas. You need to isolate yourself in your home to prevent the exposure to your household members. You want to avoid sharing any personal items, so toothbrush, towels, anything like that. You want to make sure that you only have your own and that you're not using anybody else's. And then silverware is another thing. If after a dish or silverware is used, it needs to be washed, and don't allow anybody to use it until it has been washed properly. And then you want to make sure that you're cleaning all your surfaces within your house. So your high touch areas like your countertops, your tabletops, doorknobs, light switches, walls, sides of doors, anything that's a high touch area, you want to make sure you're disinfecting it frequently to help prevent any exposure happening from anybody else in your house. And then next is going to be Laura Gamble, and she's the CEO of 12 Plans Unity Hospital, and she's going to go over what processes have changed recently.
All right. Good afternoon, everybody. Thanks for having us in your home today. There's a couple things. I'm probably going to go through my slides faster here. Some of them repeated from last week. So we know that patients now will enter through the east entrance of the hospital. Employees have been given special instructions on when and where to enter and exit the building of the hospital. All patients and employees are now being screened at the door for possible COVID-19 exposure. Employee health and infection control nurse are tracking employees. Anyone that enters the building will be required to wear a mask. Mask will be provided at the door if you don't have one. Patients are instructed to call their healthcare provider or the COVID-19 hotline before coming in to seek medical treatment. We've been working on plans for an influx of patients, which is a lot of patients if we would get a lot of patients. and we've been performing mock exercises to ensure that we are ready. And staff from all different departments have been included in this. A COVID huddle is held twice a week, and a COVID committee meets weekly. We currently have enough PPE or personal protective equipment, and we monitor this on a daily basis. The staff has access to the PPE that they need to care for the patients. We have had numerous conferences with other entities to ensure we are working together, such as Carl T. Curtis, Northeast Nebraska Public Health Department, the tribal committees. So other precautions we're taking, we're limiting the number of people in the facility, and that has decreased greatly within the last week and a half. Staff and departments throughout the hospital and health department are being rotated, and many are being asked to telework or work from home. The purpose of limiting and rotating staff is to ensure we can continue operations in case any staff becomes sick, and to also limit the amount of people in the facility to limit exposures. And additionally, supplies have been ordered. We're always looking at the PPE and making sure we have enough existing supplies too. So I want to go over the testing process. There's a lot of people that ask questions about that. We are asking right now that if you've worked in a meatpacking plant or have been in close contact with someone working in a meatpacking plant, that you do call the COVID-19 hotline, 402-922-1508. They will direct you on what steps you need to take. It's important to note that a simple clinical diagnosis without the test of a COVID-19 infection could include self-isolation and should be normal, even in the absence of a positive COVID-19 lab test. This could mean that you will be told to self-isolate like you have COVID-19, even when you have not been tested or you are waiting for test results. It is very important that you follow those instructions, even if you are not having symptoms. If COVID-19 testing is warranted, meaning criteria is met, then the test will be sent to an outside lab. We cannot test here, but we can capture the test. Current turnaround time for test results is 24 to 48 hours at the state lab, or about the same for the commercial lab right now. We have been working on ways to collect specimens so that we are limiting exposure to staff and other patients. 12 Clans Unity Hospital does have some limited testing capabilities, and criteria is used to review who should be tested. Processes have been put in place to ensure that the Winnebago Public Health Department and 12 Clans Unity Hospital are communicating test results and follow-up. This has been working very well. I wanted to go over quick what the CDC testing guidelines are, and they have a 3-step process. They have a priority 1, priority 2, priority 3. So of course the symptoms we've gone over with you, fever, cough, and shortness of breath is what they still look at. Priority 1 ensures optimal care options for all hospitalized patients, lessen the risk for healthcare associated infections, and maintain the integrity of the U.S. Healthcare system. So any hospitalized patients or health care facility workers with symptoms, that's priority 1. Priority 2 ensures that at highest risk of complication of infection are rapidly identified and appropriately triaged. Patients in long-term care facilities with symptoms, patients 65 years or age of older with symptoms, patients with underlying conditions with symptoms, and first responders with symptoms. And then priority 3, as resources allow, test individuals in the surrounding community of rapidly increasing hospital cases to decrease community spread and ensure health of essential workers. So those would be critical infrastructure workers with symptoms, individuals who do not meet any of the above criteria with symptoms, healthcare facility workers and first responders, individuals with mild symptoms and communities experiencing high numbers of COVID-19 hospitalizations, and then the non-priority are individuals without symptoms, so those that are asymptomatic. That is straight from the CDC website, and that's what states are using right now for testing criteria. The next slide pretty much goes over the same thing. The state of Nebraska has told us, this is how we want to test. This is the priority of testing, and that is what we have been using. So what are we doing here at 12 Clans and some of the other in the departments? And as I pointed out before, we have some of our healthcare workers who are wearing masks, and they're here, waiting for patients and taking care of patients. But really, to stress what Mona and Angie have said, I stay at work for you. Please stay at home for us. And that's what we need you to do. And we cannot stress that enough. So really right now in the outpatient clinic, all routine, non-urgent elective clinic appointments are being rescheduled. The outpatient clinic is changed to same day access. A patient should call ahead for that access. There will be no express care on Saturdays. Plans are in progress right now to increase telemedicine visits, and there'll be more information coming in about that. We just don't want our providers to get sick, and then we don't want to expose anyone else if someone would have symptoms or be positive. If applicable, some labs will be collected outside the building, and signs will be posted, and there will be more to come on that. So in the emergency room, if you're experiencing mild illness, please call ahead for guidance. We may tell you that you should stay home and do self-care measures. The emergency department is open as usual, but we are working on plans to care for an increased number of patients or an influx. If you come to the ED with respiratory symptoms such as cough and shortness of breath, you will be asked to place a mask on and placed in a special waiting room away from other patients without respiratory symptoms. So pharmacy, again, we're doing 90-day supplies. There's the temporary drive-through pharmacy, which is working really well. It's open Monday through Friday, 8 to 5. We ask that you use that as much as possible. Patients should call ahead for their medications, and then you can get over-the-counter medications there too, such as ibuprofen or Tylenol. We do have the regular inside pharmacy to operate as usual, but we would really encourage you to use the drive-through if you could. Really, our goal with all of that is to limit the number of people in the building so that we limit the chance of exposure to everyone. And then the next two slides, I'm going to have Sarah McIntosh, who's a nurse practitioner in the emergency department, go over some scenarios. We did go over these last week, but we want to make sure that people understand the scenarios. And next week we'll have a couple different ones. Go ahead, Sarah.
All right, Sarah, I'm going to go stop you right there. If you can turn on your microphone. And don't forget, for those who are tuning in, we do have a question and answer session. So if you do have a question, make sure you email it to COVID@Winnebago Tribe, or just comment in the chat section on YouTube, as well as the comment section on Facebook. Sarah, are you there?
Yes, sorry, I lost the screen for a second, but I got it back here. Okay, so I'm Sarah McIntosh. Good afternoon, everybody. So this is a case scenario. This is a 73-year-old female with a history of heart disease, has a fever, a slight cough, and a sore throat. The patient is not short of breath and has been managing her health at home, but is worried about that fever. The patient calls the clinic and is instructed to come to the clinic alone. She is to enter through the East ER entrance. The patient is given a mask and the nurse escorts the patient to the clinic. A nurse wearing proper protective equipment, which is a mask, a face shield, and eye protection with gloves, takes the vitals and does an assessment. The patient has a temperature of 101 degrees, otherwise all vitals are normal. The provider wearing protective equipment, which is a mask, face shield, eye protection, and gloves, does the exam. The provider feels a COVID-19 test is needed and the patient meets the criteria. In this case, the patient is over 65 years of age, with heart disease and has symptoms. With approval from the state lab, a nasopharyngeal swab is done and sent to the state lab. The results will be back in 12 to 24 hours. The patient is sent home with instructions to self-isolate and perform home care measures. The public health nurse will follow up with the patient, and the provider will inform the patient of the test results when they come back.
And just to add to that, this is Laura, but we are trying to use more than just the state lab now, and so that we have more avenues to do testing.
The next case scenario is a 58-year-old male with history of diabetes is taken to the hospital per ambulance. He has been sick for over a week and has been complaining of shortness of breath and is very tired. He did not have a thermometer at home, but his wife says he's felt warm all day. He has been taking Tylenol at home, which helps for a short period. The EMS team wears full personal protective equipment and transports the patient. They place oxygen on the patient and explain to the wife and family that they are unable to come to the hospital due to the visitation policy and for their own safety. They ensure the family that they can call the hospital at any time and they will receive updates on the patient. The staff is alerted ahead of time and is also wearing full personal protective equipment, which is a mask, face shield, gloves, and a gown when the patient arrives. The patient is taken to a special room if able, and the nurse does an assessment. The nurse notices that the patient is breathing really hard and fast and has a temperature of 101.9. He is also getting confused and his oxygen levels are going low. The patient continues to have oxygen on, but is not helping much. The nurse immediately gets a provider who is wearing full protective equipment. The provider does an assessment and feels the patient needs to have tube placed in their airway right away. The patient will be transferred to a higher level of care, such as Mercy Medical Center. The provider is unsure whether this patient has COVID-19, but will inform the accepting facility that there's a high suspicion and will ask the patient to be tested at their facility to inform us of the results. The patient is transferred per helicopter with special protective equipment for the safety of the crew. And on behalf of the entire WCHS team, we appreciate all of your cooperation and efforts to keep our community safe and healthy.
All right, thank you. At this time, we are going to have a statement from our Winnebago Tribe CEO, Esther Mercer, who's going to be joining us via telephone. Esther, are you on the line?
Yes, I am. Can you hear me?
Yep, the floor is yours.
All right, thank you. Good afternoon, everybody. I would like to thank you all for joining us today. With the recently confirmed positive COVID-19 case on the Winnebago Reservation, the Winnebago Tribal Organization will be continuing to examine and modify its operations in order to provide necessary services to the community while maintaining appropriate social distancing measures to minimize the risk of exposure and spread of the COVID-19 virus. Please be aware that as the situation evolves, our current processes may change, and to keep accessing the tribe's website for the most current up-to-date information regarding our tribal departments. The following announcements are from our tribal departments. First, from the tribal HR office. The Winnebago Tribe of Nebraska Human Resource staff is available by appointment only until further notice. For the safety of the HR staff and the public, the HR office is adhering to CDC guidelines for the workplace by limiting foot traffic in and out of the HR office. To contact HR and/or to schedule an appointment, please call them at 402-878-2272, extension 2300, or contact them via email at hr@winnebagotribe.com. To the Winnebago Tribe of Nebraska employees that are currently in layoff or furlough status, if you are experiencing issues while navigating the Nebraska Department of Labor website while filing your unemployment claim, the Winnebago Tribe HR staff is available to assist you. The HR office is pleased to report at this point a great majority of the Nebraska DOL website inquiries and issues have been worked out electronically or by calling HR with your question. If you require further assistance, please contact HR via phone or email to discuss your options. The Wake and Burial Program, in conjunction with the Public Health Department, has issued the following protocol for funeral services during the pandemic. Until further notice, the following protocol will be enforced. The Wake and Burial Program will only travel within the tri-state area to retrieve the remains of the departed. Arrangements for transportation of remains outside of the tri-state area will need to be arranged with Munderloh Smith Funeral Home. Wake and burial staff and the public health administrator will meet with only one designated family member at the Ho-Chunk Community Center to make funeral arrangements. The clothes will be taken to the funeral home by the wake and burial staff. The funeral home is required to keep the departed at the funeral home for 3 days after embalming. The remains will then be returned home on the 4th day. The wake and burial program will allow for a 1-day visitation with the funeral taking place on the following day. While we do understand that this is an emotional time for our community members, we are respectfully asking that no more than 10 people be on site at any given time during the services. Visitation will be arranged with family and will only last 10 minutes or less. No one under the age of 16 years of age will be allowed. For the final viewing, the Public Health Department staff will be on hand to temperature monitor all entering the funeral site, which includes clergy, family members, wake and burial staff, and all visitors. The Public Health Department will provide personal protective equipment to the staff as they are able and available. Meals will not be allowed. Families will need to consider having meals at an alternative site. Only 6 to 8 pallbearers will be allowed. Pallbearers will be allowed to bring the casket in initially and view the deceased. After the final viewing and the family leaves the site, pallbearers will be allowed to carry the casket to the wake and burial vehicle. Wake and burial will then transport the body to the cemetery. Pallbearers will carry the casket to the gravesite and then return to their vehicles. All burials will be done on the 5th day following the passing of the individual. Only 10 people will be allowed at the graveside service. This includes wake and burial staff, clergy, and grave diggers. From the Tribal Enrollment Office, the Tribe's Enrollment Office staff are available by appointment only until further notice. Tribal IDs are currently being issued on Tuesdays and Thursdays only. Please contact the Enrollment Office by calling 402-878-2028 or via email at enrollment@thewinnebagotribe.com. Finally, Human Services wanted to share that the departmental information is on the website and they are continuing to have open office hours from 10 to 2 daily. Applications for their services are available on the tribe's website in fillable form for your convenience. Please continue to stay safe and continue to follow the social distancing guidelines set forth by the CDC and the Public Health Department. On behalf of the Winnebago Tribe of Nebraska, thank you, stay safe, and have a wonderful day.
Thank you, Esther. At this time, we're going to turn the floor on over to Dan Farringer with the Winnebago Public Schools. Dan.
My name is Dan Farringer, Superintendent of Schools. First of all, I would like to thank the Winnebago Tribal Council and the Tribe of Nebraska for the encouraging words honoring our wrestling program and Robbie. We appreciate the jacket that they are issuing to the coaches and to Robbie for the dedication and well-deserved effort at the state meet. As far as an update, the governor again mandated the school closure, including all activities and events through May 31st, 2020. The track and athletic complex have been closed until further notice. With the extra duty activities, that includes graduation. On the websites, you'll see we posted the Winnebago Public School graduation ceremony for the class of 2020, what is planned at this time. On Thursday, April 16th, 2020, the Commissioner for the Nebraska Department of Education sent a message out regarding graduation ceremonies, guidance, and interpretation. 1, the limits on gatherings apply to all types of graduation ceremonies. Graduation ceremonies are interpreted as an extracurricular activity and are ordered to cease per the directed health mandate for schools, which at this time goes through May 31st, 2020. Virtual graduation ceremonies are permitted during this time. All in-person graduation ceremonies and celebrations must meet the statewide directed health measure order or should be postponed until such a time that the statewide order is lifted and that subsequent orders would clearly permit such gatherings. Efforts to dismiss or subvert the directed health measures may be considered a violation of school accreditation or approved rules related to health and safety and may be considered a violation of ethical standards for certified school officials. Therefore, the Winnebago Public Schools Board of Education voted to set the graduation ceremony date to Saturday, August 1st, 2020. Any directed health measures in place on August 1st will be followed. For the seniors, Mrs. Tremaine will contact the seniors after May 9th and set up a time to pick up a copy of their diploma. The original diploma will be distributed at the graduation ceremony on August 1st, 2020. The food service staff continues to work hard. We delivered meals today through next Thursday, April 30th. Due to the new circumstances, we're not sure if we'll have a delivery next week or not. We're waiting on some outcome due to some social distancing and some contact with some of our staff with the situation that arose earlier. That brings me to the final thing, that there will be no one at WPS this tomorrow or Monday at this time until we know more due to the circumstances that arose today. Again, we'll get through this. We just have to keep working together and be safe. Thank you.
Thank you, Dan. At this time, we're going to go to the president of Little Priest Tribal College, Manoj. Manoj, the floor is yours.
Can you guys hear me?
Yep, we can hear you.
Okay. This is Manoj Patil, president at Little Priest Tribal College. Before I go through the list, just want to again take this opportunity to thank Garen Kuntz and his team for making this happen. Special thanks to Tribal Council for their leadership. Special shout out to the Pandemic Task Force for all this, for all their work. And again, from the college, I wish everybody safe health and stay safe. And special thanks to, of course, the Winnebago Public Health System. So these are the following list of things I've jotted down. We are having a specialized training for faculty in the month of May for online instruction. As summer semester is completely online, we are providing adequate and extra training for all faculty, including adjuncts. Our summer enrollment is open and it's looking good. Currently, as of right now, it's 26 students. I also want to take this opportunity to announce that summer classes at Little Priest is free, tuition and fees. So I really, really recommend all the audience up there to take advantage of this situation and take this opportunity to increase your knowledge and learning. April 30th is the last day for spring 2020. We are giving some extra time for students, especially who are having struggles with the technology, to make sure they complete their work. Happy to share that our Paycheck Protection Program, the PPP loan, has been closed, and we are hoping the majority is forgiven after the end of 8 weeks. Also, our first BIE funding for Little Priest has come through. We'll be using that money to improve our technology services to the students, to the staff, and to the faculty, and to provide emergency student aid as needed. Our summer semester starts on May 26th and goes till July 16th. Please contact Little Priest Tribal College Office of Admissions or visit littlepriest.edu for further information. LPTC is putting together an extensive technology plan for students for summer and fall. So AICF, the American Indian College Fund, has obtained some tablets from Amazon, which will be distributed to all TCUs, tribal colleges and universities. And we are hoping we get a good chunk of that quota so that all students will have adequate technology when they take our classes, which are completely online in summer. 10 laptops are already donated to Little Priest for faculty purposes from AICF. And we are waiting for their arrival this week. LPTC will be hosting a new website within the next 2 weeks. This new website will be live, hopefully on May 1st. And we'll be updating this on Facebook page when it happens. Our main goal is student success. Our focus is our student success. And we want to also take care of our faculty and employees as we tread into unknown waters. Again, on behalf of the college and personally for me, I just want you guys to know that we are there for the community and for our student body. Please reach out to me directly or to the college if there's anything we can provide at this particular time. Wish you and your families safe health. Take care.
Thank you, Manoj. And please stick around. We might have some questions later on in the question and answer session for Little Priest Tribal College. At this time, we'd like to have the General Manager of Winnebago Casino, Mayan Beltran, to address the Winnebago community. Mayan.
Good afternoon, everybody. Can you hear me?
Yes.
Yes? Okay. Good afternoon. So, from Winnebago Casino Resort, we'd like to first thank all of our first responders, our healthcare workers, and essential workers on the front lines fighting to help defeat COVID-19. Thank you. All of us at Winnebago Casino Resort want you to know we're grateful for your hard work and dedication during this unprecedented time. To all of our friends in Siouxland, thank you for helping to flatten the curve. Here at Winnebago, we've been busy preparing the resort and developing training and guidelines for when we are able to open back up. We are currently following the news briefings by Governor Reynolds daily to ensure that we open up when everybody else is safe and ready to open up their businesses. We're also working to develop our guidelines of opening up to coincide with the National Indian Gaming Commission, their guidelines that they're setting forth for tribal casinos to open back up. So we're working on training and health and sanitizing procedures for each department. We're working on comprehensive outline for every area of the casino and how that's going to look when we reopen our casino for everyone. So for the continued safety of our team members and our guests. Remember, we're all in this together and we can't wait to see you again. Thank you.
Thank you, Mayan. Sam Burrish from the Ho Chunk Incorporated, Communications Manager. Sam, if you would, the floor is yours.
Good afternoon. Thank you, Garen. I'm Sam Burris with Ho Chunk Inc. I'd like to start with an update on the Pony Express convenience stores. Our retail locations in the Winnebago community are closing at 7 p.m. in accordance with the curfew. We're continuing best practices for customer and employee safety. All Pony Express employees have been given masks. We are also starting health screenings for all convenience store employees. As a reminder, we already began regular cleanings, professional disinfecting, plexiglass barriers, social distancing, and other precautions at these locations. The new case of COVID in the Winnebago community is unfortunate, but something we have planned for. We are now executing those plans. In Winnebago, we are going to do the FDA-approved deep clean fogging at each office location as soon as possible. We're also in the process of supplying masks to all non-telework employees and encouraging the use of personal masks in addition to new guidelines. As a reminder, local and regional locations are locked with visitors by appointment only and subject to screening. We do have a special COVID paid sick leave policy, and we are telling employees who don't feel well to stay home. We're communicating with all employees, including twice a week interactive video sessions. Telework has already greatly reduced in-person staffing at the Winnebago offices. That said, most of Ho-Chunk Inc.'s business is in federal government contracting, which is essential work to keep the government running. So we must keep functioning in some capacity to protect jobs and help the tribe. If things change significantly, then we will also change. On a positive note, the staff at HCI Distribution are helping the Winnebago Food Pantry identify storage space for all the food deliveries for the food pantry. I know people are also interested in the Ho-Chunk Farms cattle purchase. We are working on producing stories and photos to inform the community of those efforts. Look for more information next week on the Ho-Chunk Inc. Facebook page, and those stories will also be available in the Winnebago Indian News. I appreciate everyone's time today. Those are the updates I have, and I want to thank everyone in the community for coming together during this time.
Thank you for the update, Sam. At this time, we have the Executive Director of Ho-Chunk Community Development Corporation, Brian Mathers. Brian?
Thanks, Garen. I just want to remind people that our offices are open, but we're not having office visitors at Ho-Chunk Community Development Corporation. We have office staff there, so if you need to call, if you need to make an appointment, please, you can call us at 402-878-2192. We're also doing the rotating staff and the telework to reduce the amount of face-to-face contact people are there. Please be watching in the coming days for a survey that's going to come out about housing situation and whether or not there are a lot of families that are doubled up or that are having difficulty isolating, or that for whom it would be difficult to follow any of the health department's recommendations about isolating if they had a family member that was being tested or that had tested positive or something like that. We want to get as many responses to that as possible, because we can use that then to build a case for some of the grant work that we're doing. So we'll be sending out a link to that survey. I'll ask you, Aaron, to help distribute that through the tribe's email and the tribe's Facebook page. And so please for that. HCCDC has also been just doing a lot of coordination of grant and foundation funding, trying to get some of those things in place. The primary areas that we're looking to find resources for and help with are to expand the food pantry, to help with rent assistance for families that are impacted, and to work on community connectivity, for distance learning, for internet access and Wi-Fi access, for staying connected to get updated information like this today, and other instructions and guidance from our healthcare providers. And then the last thing is, there was a question last week about the availability of loans. That's another thing that we're looking into, possibility through the Ho-Chunk Community Capital entity of ours to help people that have been impacted by COVID-19 with a low interest loan, just for short-term expenses or things like that. So when we have some parameters and some ideas about the amount of resources for that, we'll also get out programming information and tell people how to apply and follow up. So those are the things that we're working on. As others have said, I would also like to reiterate, it's an additional concern today because a case has been identified, but it's not a reason to panic. The community has done a great job so far of planning, preparing to respond. Everyone's talking to each other. I feel tremendous amount of confidence in the reliability of information that we're getting, and I think that will go a long way to easing people's fear. We need to plan to stay in this mode for the long haul, as it's not something that we can walk away from in a week or two just because we get bored with it or something. So we're just going to need to dig in and rely on each other for support to get through it. So thanks.
Thank you, Brian. Now we're going to turn our attention to the chairman of the Winnebago Pandemic Task Force, and that is the vice chairman of the Winnebago Tribe, Mr. John Snowball. Chairman Snowball?
How do I sound, Garen?
Sound good. Floor is yours.
Good afternoon, membership. Good afternoon, community members and the workforce. The task force continues to meet, and subcommittees continue to meet, and we have our best people around those tables, moving forward with what we have to do. We're preparing the article for the win, and we're also looking into social media, how we can give more updates on the task force. The $8 billion coronavirus relief fund, the task force has had a collaborative effort on ensuring that the Winnebago tribe receives its fair share of that. It was expected to drop tomorrow. We were supposed to receive those funds, but there has been a lawsuit, and so those funds will be delayed. The food pantry is moving forward. We're identifying where we can receive those items, where we can order those items, and a time frame of 10 days has been said that we want it to be up and running to help our community members and in their food security. And with the meat plants and the meat processors, with all of what's going on with them, myself as the Wildlife and Parks Director, I would encourage anybody to reach out to myself or Jewel Parker if they are in need. We do have meat on hand. We have a freezer, and we have a healthy buffalo herd. So we want to utilize that for the community. So I would encourage anybody to reach out to us. The curfew is going well. We have 2 wildlife officers working that, and the police department. So it's one measure, and we're looking at other measures. And the virus, it's here. And my dad texted me this morning, and he kind of heard about it. He was asking me, he's like, "Oh, well, what's the next move?" And I was like, I feel real good, real confident about that. We prepared, and we did a lot. We did everything we could before it got here, and now it's here. So I think it's up to each one of us to protect our families and to protect each other. Remember that if you have contact with somebody outside of your household, and now both of your households are involved in each contact that you was with, and so on and so forth. So the more social distancing that you can do, it's good for your family, and it's good for the family that you're staying away from. So that's what I told my dad this morning. I said, I think it's going to be up to each one of us now. I think, I feel confident that we did good, and it's here now. As far as the masks, we talked about masks. The task force was talking about masks. Talking about we have as a tribal government, we have the authority and we have the ability to make masks required in any place that has a visitor. And to me, I say there's nothing off the table that we, every little bit will help. We'll never know if anything worked, if we kept one person from getting sick, but we can do what we can do. And a resolution has been developed for that. And we've ordered 1,500 masks, and they're due to be done tomorrow. And we discussed doing a reorder with those same sewists and getting more masks and rolling that out to where we can we can ensure that every place that has a visitor, anybody going in there will have a mask on, and how we can make that happen, utilizing all the resources that we have, and that's coming. That's going to move forward. Those things are in motion, and I would just encourage the community member and the work and members in the workforce to let them know that that I'm thinking of them, and that I'm thinking each one of them, and I'm really trying to do my social distancing and staying home, and and thinking about the families that are some of my friends or some of my coworkers that that I might want to go see them, I might want to go talk to them, and release some stress, but understand that I put my family at risk, and I put their family at risk when I do that, and even my own family, my dad or my aunts, how we're keeping each other safe with that social distancing, and protecting each household, each one of us, one family at a time. We can do it, and so I want to say about that much. Thank you, Garen.
Thank you, John. At this time, we are going to have Emily from 12 Clans, and she's going to go into the question and answer portion. And this set of questions is directed towards the healthcare officials. And then we do have some questions for Coley as well as John. So Emily, the floor is yours.
Thank you, Garen. Again, my name is Emily Longuski, and I'm the communications manager for the Winnebago Comprehensive Healthcare System. If you have any questions, please email covid@winnebagotribe.com your questions, or input them on the live stream chat box on Facebook or YouTube, and we will do our best to answer them. So I'm going to start off with all the questions directed to the healthcare and health department workers. So the first question, has 12 Clans considered drive-through COVID-19 testing? Laura, can you answer that one for us?
Yeah, currently we're looking at all options for testing at this time. We need to do this very organized. As you know, we have been testing some people at this time, but we're working with the health department. We're working with the medical staff here to look at all the options that would help us test more people. We also have to make sure we're working with the places that we send the tests, that they're able to take those tests and the number of tests that they'll be able to take. And so there's a lot of moving parts with that. But yes, we're looking at every type of testing we could do here, and more to come on that in the future.
Great, thank you so much. Next question. Can you tell the viewers what a herd immunity is? Are we considering it? I think all options should be on the table. That question was directed toward the health department. So Angie, can you take that one?
Yeah, so herd immunity is when a large number of individuals that live in one community have developed immunity or antibody to the virus or to the infection to prevent the spread to other people. So the only way to get the herd immunity is to actually be exposed to the virus and have your body make those antibodies, just like you would with a cold or strep throat. Your body makes antibodies for those, and that protects that one individual from getting it again. So herd immunity will only happen over time. It's nothing that we can do right now. We don't want to expose our community members to the infection. We want to keep them as safe as possible and hopefully wait until a vaccine comes.
Thank you, Angie. Mona, this question is for you. One viewer commented that they have heard that casinos in other portions of the country have reopened with the help of their health departments. Can we get workers from the health department at our casino so that they can open back up?
I'm sorry about that. Mona, I'm going to have you turn on your microphone, if you would. Go ahead and give us a sound check.
Sorry about that.
There you go.
Yes. Okay. Sorry about that. Now that we actually have a positive case in Winnebago, I think it's going to be difficult for us at this time to send any other workers over to the casino until our curve starts to flatten, and then we can look at assisting the casino as we're able to.
Okay, thank you. Next question. We have a lot of tribal members that work at the meat packing plants in the area. What are we doing, or are we doing anything for them? Mona, can you take that one?
Yeah, so we have put out a call about a week and a half ago for all of those that are working at a meat packing plant that are community members to please call the COVID hotline. Obviously, since we put out that information on Facebook, we have received several calls that we've been tracking and monitoring. But we also are working with some of the other area county health departments in order to, because Tyson and Seaboard really look at a whole vast of employees, not just Winnebago. And so we're really trying to work with them in order to get some other resources for our tribal members and community members to be able to access. And so we have a list of those individuals, and so we are following up with them, and we're going to be accessing some testing for them very soon.
Thank you so much. Next question. We got this via email. Are we ready for the second wave of this virus? They heard that it would be back in the winter along with the flu. Angie, from a public health nursing perspective, can you answer that?
Yeah, so the second wave of the virus would be if it were to happen when social distancing or measures were to be lifted and were to hopefully not be lifted all at once, but gradually lifted, and then we were to see an increased number in COVID cases. There's more research and information coming out if this virus is going to be a seasonal infection, much like the flu. They're still getting information about that, so that's yet to be 100% determined, but it is, they are believing it is, that it could be possible. So right now, with the being a second wave, we're just trying to focus on what needs to be done with this one currently, and then the measures that need to be taken to keep our community safe right now. And then if a second wave or that potential of a second wave is possible, then we will follow up with additional measures or with the same measures that we are doing right now.
Okay. Next question, and this was kind of general, but I think Mona and Angie, you know what this is in reference to. The question is, does our health department know anything about the Test Nebraska?
So what I know about the Nebraska's test is that you go online and you fill out a survey, and then you're ranked on priority. And I believe within the next 10 days that they would be launching, starting in Sarpy County, which is Lincoln, and then deploying different areas that have a lot of clusters for those surveys, and then doing the testing at those locations. Angie, do you have anything else to add to that?
Yeah, so with what Mona said, you would get on, there's a website called testnebraska.com, I believe.
Mm-hmm. Yeah.
And on that website, it will ask you a series of questions. So it's going to ask you your demographics, contact information. It will ask about any symptoms that you have, the number of household members, your employment status, and what that entails. So if you're a salesperson or working in the meat packing facilities or anything like that, they do ask that. They'll just ask a series of questions to help prioritize the people that need to be tested right away, and then those on different levels. And then they will contact you once a testing site is available and in the location. And then I believe they give you your appointment time for that testing as well.
And this is Laura. They're doing that in Iowa too, and they have rolled it out there. And actually, they're a little further ahead than Nebraska. Their first testing site will be in Des Moines on Saturday. So just so everybody knows that, those that are from Sioux City or in that area.
Thank you all. Next question, where can I get a face mask? I see a lot of people not wearing them. I think we should be required to wear them and to get those that don't have them on.
So the CHR program, if you want to call them at 402-878-2277, they are have a waiting list, which I think they got all of the first waiting list, all received masks this week. But as John indicated, that they're getting more masks in within the next day or two. So we'll be coordinating off of that waiting list. So if you don't have one, please call the CHR department so that we can get you on that list and then get you a mask as soon as they're available. As John also indicated, that there is a resolution that's looking at making masks mandatory on the reservation in our community. And so that's still being reviewed.
Okay, thank you. The next question I'm going to direct towards Laura. Do we have enough tests for people since each state receives their own?
We would not have enough tests to test everybody. We have limited testing. We do have enough to do some of the community, but that's why we have strict testing criteria. The other thing that people have to realize is that it's not just the test, it's the swabs that are also hard to get, the swabs that are being used. And so we have to really watch that we're using those for the people that meet the criteria. The state really is not testing asymptomatic people unless they're under those certain criteria that I went over. So it's very, we have to watch the testing judiciously, and we have a team that looks at this, and we look at it almost every day at how much testing we have, how much we've done, and how many are we going to test in the future.
Okay, thank you, Laura. This next one, Angie, I'm going to direct towards you. For people who are in isolation or quarantine, will they be provided a thermometer if they do not have one?
Yes, so we do have disposable thermometers that can be used more than one time, but we can give you enough to get you hopefully through that quarantine period. They are a little plastic thing that you put underneath your tongue, and you'd have to leave it there for a minute. And then there will show dots on a reading on the actual thermometer. So we do have those available. We are looking to try to get more digitized monitors, but unfortunately they are not available on any means through what we have access to. So we are still trying to locate those. And then once those are available, or if they are available, then we can distribute those as well. But we do have disposable ones for the meantime.
Great, thank you, Angie. Last one from Mona. What should we do if we have a hard time getting through the COVID hotline?
So I know that we've had a pretty influx of calls, especially today, with all of the positive case that we've had. So if you don't get through the first time, we are trying to call back everybody from their number. So if you get a call back within that next 30 minutes, please answer the call, because it's probably from the COVID hotline, trying to return your phone call. We have also been trying to send out texts so that we acknowledge your call, and that we'll get someone to you as soon as we can.
Awesome, thank you so much, Mona. The next one I'm going to direct towards Sarah or Laura, either one wants to answer. How does the cough develop? Does postnasal drip start before the cough?
Okay, yep, I can take that. The postnasal, so I'm just going to explain a little bit about a cough. So there's really no medical criteria to classify a dry cough or a wet cough, because it's pretty much how the patient explains the cough per se. But in general, a dry cough means that you're coughing up nothing. When you're coughing, nothing's coming up like any phlegm or mucus. However, many things can also cause a dry cough, including allergies, like being out indoors with dry air all day. People that have postnasal drip probably from allergies, people that have like reflux disease, smoking, asthma. There's other things that can cause a dry cough. So in general, it starts as a dry cough, but also for the COVID, you'd have usually other symptoms with that. Did I explain that okay? Answer the question fully?
Yeah, I think so. That made sense.
Okay.
Thank you. And this is actually a question for you as well, Sarah. Can you elaborate on what sterile hand washing techniques are? There's been a lot of questions on if people are actually getting their hands clean. So I didn't know if you had any tips or could elaborate on that more.
Yep, and we can maybe put this out on our website also through 12 Plans. So I'm just going to explain a couple different, so you can use soap and you can use alcohol-based sanitizer. So I'm just going to give a couple quick tips on following steps to wash your hands the right way. So washing our hands is really easy, and it's actually one of the most effective ways to prevent the spread of germs. Clean hands can stop germs from spreading from one person to another and throughout an entire community, from your home and workplace to facilities and hospitals. So follow these 5 steps, and we can put this out on the 12 Plans webpage. But wet your hands with clean running water, warm or cold. Turn off the water and apply soap. You're going to lather your hands by rubbing them together with the soap. Make sure you get the back of your hands between your fingers and under your fingernails. Scrub your hands for at least 20 seconds, and if somebody wants to hum the happy birthday song 2 times all the way to the end, and that will give you a full 20 seconds plus. And then you're going to want to rinse your hands well under clean running water, and make sure you dry your hands using a clean towel, or you can air dry them. When do we use hand sanitizer? So washing your hands with soap and water is the best way to get rid of germs in most situations, but if soap and water are not readily available, you can also use an alcohol-based hand sanitizer that it contains at least 60% alcohol. You can tell if it contains 60% alcohol by looking at the product label, and it will tell you that. Sanitizers can quickly reduce the number of germs on our hands in many situations. However, they do not get rid of all types of germs. So hand sanitizers may not be as effective when hands are visibly dirty and greasy. Hand sanitizers may not remove harmful chemicals from hands like pesticides and heavy metals. So that's when you'd want to use soap and water. So how would you use hand sanitizer? You're going to apply the gel product to the palm of one hand. You're going to rub your hands together. You're going to rub them together very vigorously. You're going to rub them over all hand surfaces, including between your fingers, on the front and the back of your hands. And you're going to do this until your hands are completely dry. And this should take at least 20 seconds. So again, you can hum the happy birthday song twice from the beginning to the end, which will get you a full 20 seconds plus.
Awesome. Thank you so much, Sarah. That concludes all the questions we had for the healthcare and health department. Garen, I'm going to toss it over to you to go through the tribal council questions.
Okay, thank you. We do have Chairman Brown here, as well as Vice Chairman Snowball, to take these questions. And so this first one is directed to the pandemic chairman. John, this question is coming in. How much are we expected to receive? I am requesting to know the numbers of relief funding we are expecting as a concerned community member and tribal citizens, mother and grandmother of tribal citizens, and elder.
Yes, there has been no decisions on who will receive what yet and how that's going to be divided up against to the tribes. Currently, there's a lawsuit that has held it up, and when those funds do come, they will be for relief, COVID-19 related, and unbudgeted, which means that we can't have it already in our budget. It had to be something new because of this COVID-19, and it needs to be an expense in a certain time frame. So that information has not been given to the tribe yet. and the tribe has taken a role and taken a point of view of being open to its tribal members and understanding that that's beneficial for all of us. So when that does come through, myself as the vice chairman and the chairman of the task force, I'm ready to be open with that information. Thank you.
There's a second portion, I guess, to this question, or question number 2. Who or what is in control of that money? The COVID-19 task force, question mark? Valid questions we all need to know. Transparency and accountability is vital now.
The relief funds, the $8 billion from the CARES Act that's going to the Indian tribes is going to be controlled by the tribal government, the tribal council. The task force has no decision powers. The task force, its intentions, what it's meant to do is give the tribe the best options, utilizing all of our resources and all of our best people to give the tribal council and the tribal government the best options. At this point, that's not the role of the task force to make these decisions. It's the role to make the recommendations to the tribal council.
Thank you. This one is directed to Chairman Brown. Last night, there was a story on the news that the hogs that are being raised by farmers are not be able to be taken to the processors. Is the tribal council going to purchase hogs for the community?
Not at this point. We have not discussed that yet as a whole body, but tomorrow we have a treasurer's report meeting at 10 a.m. and we can bring that up for discussion.
Okay, question number 2 for Chairman. Do we have to purchase bison, question mark? If so, what is the cost? Or maybe that's a question for John.
That is correct, Garen. That's a question for me. There is no cost at this point to the bison. We are giving it out to community members. We was exploring the economic area of having the bison herd, but due to this pandemic, we have altered our plan on that, and we are giving it out to community members at no cost.
Thank you. The next question, as far as the meat plants such as Tyson, is the tribe going to put stipulations on those who continue to work there? Chairman.
Again, we have not discussed that as a body, tribal council as a whole, and I suppose tomorrow we will discuss that too.
Next question. A lot of off-reservation people have been down at the river. Are we going to cut that off for only tribal members?
So during the last meeting, I think it was 2 meetings ago, Councilwoman Kitcheon had made that comment that she had noticed people down there, non-community, and during this pandemic, that wasn't smart. And I told her that I would take that on and address that on a department level as the director of that department. And so we did. Our wildlife officers took 2 main areas, the curfew and the river area during nice weather. We understand that a lot of people want to come down. So this past weekend was the first time that we really wanted to enforce that no community members at our recreation down there. And we were able to ask 59 non-community members to leave and to inform them that it was closed until further notice. And it was a good situation. It was taken well by all the visitors that come, and they said that they understood and they looked forward to when this pandemic is over, so they can become our visitors again. So those efforts have been made, and we're looking forward to how we can increase that and get signage, and so that it's well known that it is now closed to non-community members.
Thank you. Next question. Since COVID, some have taken a big hit with their jobs due to receiving tribal appropriation. Is the tribal council going to cut back their salary as well, since we don't have revenue coming in? Chairman.
Some of the tribal councils salary comes from IDC funds, that's grant funds. I really don't know where we're at the point of looking at cutting our revenue funds to sponsor tribal council salaries. That may be up for discussion tomorrow too.
I can speak on that, Garen. So, so before we did the layoffs, we had a meeting, and in that meeting we identified the essential people, not only the council, but how we can continue to operate as a government and provide the services to our people, and continue without the revenue from the casino. And those plans have been made, and we made those cuts, and we found out that we can operate, and identified that and made those cuts, and how we can operate through next year without the casino even opening. So we've made those plans, those worst case scenario plans, to continue to operate as government, to continue to provide those services to our membership. Those are tough decisions, and our people are making them. Thank you.
Thank you. The next question here is, since we're under COVID, is the county, are we going to switch to online ordering or curbside at Dollar General?
I don't know.
So
John, go ahead.
So the Dollar General has shown little proactiveness during this pandemic. Most of the stuff that you've seen at Dollar General has been initiated by the tribal government, by the council, by putting ordinances in place. And there's already ordinance in place that limits 5 people in the Dollar General. But the Dollar General isn't going to enforce that. They're not going to have more workers to enforce that ordinance. It's going to fall upon us to do that. So the next thing is the masks, requiring people to wear masks in Dollar General. So only 5 people, and you have to have a mask on. So, but we need to have the resources, the staff resources, to make sure that that's enforced. And we have identified that. We're going, as soon as that rolls out, we're going to have people there making sure that we're following those safety precautions to help curb the community spread. Thank you.
Next question. Chairman always says that we have money in the bank and we will be all right. If that's the case, what good is that money sitting in the bank? I think the council should give the tribal members a stimulus. If ever a case when we need it the most, it would be now. Chairman.
Like I said, I'm very proud of our past and our current tribal council members, tribal council, for the amount of money that we have in the bank for emergency situations. We stress a lot that we don't want to spend, we want that free money. We will fight for that free money. We will apply for it, and we hope to get it. We hope to use that money in the future to increase our revenue, so we can benefit some of our programs. Things that we can do. We're trying to have a plan, always to benefit all tribal members of this tribe across the board. And at that point, we haven't heard much. We haven't heard that how it is going out there with the unemployment. It'd be nice to get written statements, complaints, requests, and we will always try to fulfill those requests for you guys.
Thank you. Next question. Social distancing powwows are happening all over the country. I think that we will still be in the middle of the pandemic in the summer. Is the powwow committee planning for a virtual Winnebago homecoming celebration? I don't think we want all the visitors coming to Winnebago because they will bring the virus. I love powwow, but I love my elders more.
So our powwow committee has done an amazing job. I've never seen plans that far out. Now, I was really encouraged in seeing that the veterans were a part of that, and they called upon some of the powwow people in our community to help them, and it was working together, and it was really looking good, and I was proud of that. You know, it made me really think that this was going to be a good powwow, and we was going to move forward. And you know, Winnebago powwow is my favorite. You know, I've been all over, but that's true when I say that it is my favorite. And I think it's the best powwow grounds. And I think it's too early to understand, or you know, we gotta wait. We don't know what it's going to be like. And even as far as revenue wise, you know, the casino pays for the powwow, and the virtual powwow, I've seen it too. And I think all options are there, and I think we're going to make the right decision when it's time to make that decision, because of the powwow community that's there, and the council that's here, and our community, and how much we love our celebration, how important it is for us to recognize that date and what happened and why we celebrate. And so I think we're going to do the right thing, and we're going to make the right decisions when it's time. Thank you.
I think we'll initiate a meeting or something soon to discuss that with our powwow committee, to get something going, rolling, and start having talks.
Next question. Nebraska primary election is May 12th, 2020. I don't want to risk going to the polls. Will the tribe be doing any safety measures for the upcoming primary elections? Will Winnebago have a polling site?
I've been asked by a few tribal members who the tribe is sponsoring now. And again, tomorrow we will discuss that, who the tribal council is endorsing for the upcoming election. And you will be notified.
Thank you. Last question here. What was the information leak, and what is being done about it?
The information leak, what I know, it was some information that was submitted to the Treasury Department. Right now, information about acres of land, how many people we have, maybe our income, but I am pretty sure, but I don't know, that our bank accounts, and it should affect any of our funding or our money.
To my best knowledge, the information leak was a spreadsheet and of the tribes who were applying for those relief funds, and it wasn't a full spreadsheet. It was only a spreadsheet that was up to a point. There was other applicants that happened after that, and I think it's really disheartening that information was not that was protected, and it was loosely handled, and it got out. It was leaked, and so now people know, you know, and I don't know if it was on purpose or why it happened, but people can see each tribe, their contact people, and their annual revenue, and I really hope that moving forward that's not used against any tribe, you know, and I know each tribe is different, and they have their own goals, and they have their own values, and they should be treated that way, you know, and it's really disheartening to see that a full list of all of us was put out, and I think it can have some negative consequences on financial and rewards and grants, and you know, to have that information out there. I believe it to be private, and I stand with Indian country, and I think that there's some lawsuits that were filed already from some tribes, and I think a letter came out from the Winnebago tribe saying that, you know, we disagree with that, and that we feel it's wrong, and we want to know what's going to happen, and how this won't happen again in the future. So that's about how much I'll say on that. Thank you.
Things like that happen every day in the world, and as soon as we find out the severity of it, we will let the community member know and release another statement.
Thank you, Chairman Brown and Vice Chairman Snowball. Just a few comments here. A lot of people are saying thank you. Stay healthy. We appreciate the updates and the transparency, both to the Tribal Council Chairman and also the Health Department. A comment here reads, keep in mind the majority of our demographics is below poverty level, and everything that comes with that. Include all the worst case scenarios. Delivery of items is a great idea. Love and honor the elders. Maybe put some signs at the roundabout. I believe there is some signs that we put up, and Emily from 12 Clans did that this week. And then also just a quick note for those viewers that are still with us, Whirling Thunder, let's see here. Emily had kind of one thing here to end with, and Emily, I'm going to turn it over to you here to address that PSA.
Yeah, there is going to be some, I believe, operational updates to the Wellness Center. Mona, do you want to elaborate on that, or is there any other information you want to say?
So our premise was to allow the Whirling Thunder workout rooms to be in operation with the limited staff and all these measures in place, but our cutoff was when we received a positive case. So that has enacted. We have closed Whirling Thunder Wellness. That staff has been redirected to increase their efforts with the elder meal program. So they'll be helping Mary and Lloyd do the evening meals that have been delivered with the afternoon meals. So they have like a freezer workshop type of meal that they have, and it's available to them. So we just wanted to make that aware that the workout rooms are now closed.
All right, thank you, Mona. Emily, I think we got everything. Just want to remind the folks, if you have any questions or concerns, give time, but that Winnebago COVID-19 hotline is 402-922-1508. So if you have any questions, and then next Thursday, mark your calendar, as we will also be doing the weekly community COVID-19 live stream. And with that, stay safe, stay home, and stay healthy. Make sure to use those precautions, wash your hands, and you folks, we'll see you down the road. Thank you.
Thank you all.